There's a lot of stigmas surrounding the diagnosis of diabetes. So it's a really tough diagnosis. There's a lot of guilt around it.
Diabetes is not fun. I didn't realize that in the beginning. But as I'm getting older and getting on more on medication, it's keeping me on my toes.
It helps a lot to help them feel more comfortable with that diabetes diagnosis and also help them to understand that they can manage it, that they can live a healthy life with diabetes. Most people at some point or another are struggling with diabetes, and that can change from day to day. You know, they're struggling with diabetes management because it's a 24/7 job. It doesn't turn off. They'll have good days and they'll have bad days. I think it's really important for people to have a strong social support system when dealing with diabetes.
Hi Shirani, how are you?
Hi, how are you?
Diabetes, it is a metabolic disorder. If a patient does not have enough insulin for a couple of different reasons. Either you're not making enough insulin or the amount of insulin you're making, your body is not utilizing it properly. And if you don't have enough insulin, your glucose goes high and that results in diabetes.
Some of the classic symptoms of having diabetes is increased urination, increased thirst, and increased hunger. But patients also might experience a loss of weight. They might experience fatigue and tiredness. But one of the things that's most important is screening. If you have risk factors for diabetes, it's important to get screened by your physician annually for diabetes. And those risk factors include things like family history, age over 45, ethnicity. A person of color have a higher risk of developing diabetes because most people when diagnosed with diabetes have probably had it for 7 to 9 years prior to the diagnosis.
If someone has gestational diabetes, this is diabetes during pregnancy, they are also at risk for diabetes. Usually anyone who has gestational diabetes is at risk for developing diabetes in the next 10 years. It's as high as 50%. So we tell all our gestational diabetics to definitely after they deliver their baby to follow up with their primary care.
Half the plate vegetables, because a quarter of this plate over here would be about 45 grams of carb. And actually,
well, this is the Outpatient Diabetes Center. We see our patients here for diabetes education. They meet with a dietitian or a nurse. All of our staff are certified diabetes educators. We help patients to learn how to self-manage their diabetes. Our inpatient program is also very important. We have a full-time diabetes educator in the hospital also who sees our patients who are admitted. And that's an opportunity for us to teach them some new skills, to refer them to the outpatient program where they can get more detailed education. But it's just another opportunity to reach them.
I've had patients, a lot of patients, when they realize the importance of diet and exercise, they can pretty much knock off. If they're taking 4 medications, they can probably do without 1.5 medications. They may not realize it, but once they realize it, it really opens their eyes and says, oh my God, I can do so much with diet and exercise and I want to do it.
Welcome back. So, how are things going?
Good. I was diagnosed in 1998. My sugar levels were high in the morning and I was diagnosed with diabetes. My mother was diabetic. My grandmother was diabetic. So yes, it does run in the family. It's something to think about. It can happen to all of us. I come from India and our food is highly rich and has lots of carbohydrates, so I have to watch for that. At home, it's not too bad because I have full control. I stick to vegetables and we spice it up and that's edible and we enjoy it. I have been to 3 classes. I think I enjoyed it more because there were peers there for me, where we shared ideas, how to eat, what not to eat, and we could give our feedback as to what we are eating. And then, of course, VIDA and the Washington Hospital team, the diabetic department team, helped because they were able to give more insight. I would recommend anyone who's diabetic to go to these classes, and I'm glad I went.
There are certainly positive outcomes about diabetes. You can live a healthy and regular life with a diagnosis of diabetes through lifestyle modifications and medications if you require them. There is no reason that you can't live the life that you were guaranteed before the diagnosis.
Learn more about diabetes prevention at BayAreaHealthierTogether.com.